Meanwhile, the CDC is figuring out if heart issues in young people are linked to the vaccine. A rare number of young people reported having heart inflammation after getting their shots. Channel 3 Waterbury Bureau Chief Dennis Valera asked local doctors about this. He is live in the newsroom. And Dennis, they have already treated a few patients with this condition.
Yes, Aaron, that's right. Yale New Haven Health has seen 4 of their patients get this shortly after their second shot, but all of them have recovered. Now, as this continues to be investigated, both doctors I spoke to today stress the benefits of getting vaccinated outweigh the risks of getting COVID-19.
Days before the Pfizer vaccine opened to 12 to 15-year-olds, Dr. Jill Bernstein at Stay Well Health in Waterbury said interest was high. Now, nearly 2 weeks later, it hasn't lost steam.
The good news is that the CDC recently came out and said that you now don't have to wait 2 weeks between getting other vaccines and the COVID vaccine. So it's even easier for them to get their vaccine.
Side effects have always been a deterrent, so there is some worry that cases of myocarditis, which is an inflammation of the heart muscle that affects how the heart pumps blood, could fuel hesitancy. The CDC says it's happening in some young vaccinated people, usually within 4 days of vaccination, more so after the second dose than first. Also, it's happening more in boys. They report the cases are mild, which is what Yale New Haven Health found in their 4 cases.
We haven't seen anybody who required a longer term hospitalization or any sort of critical care, what you might think of as things like ventilators and blood pressure support and heart medications.
Dr. Jeremy Asness says chest pain is the biggest red flag, but he adds myocarditis is not unusual in children.
There are children who come in with myocarditis and pericarditis throughout the year.
Dr. Bernstein says until more data comes out, vaccines are still safe.
Even though COVID is, in most kids, a milder disease than in adults, you can have a severe COVID in children and even have long-term sequelae.
Now, the latest state data shows around 26,000 12 to 15-year-olds have gotten at least 1 dose so far. Live in the newsroom, Dennis Valera, Channel 3 Eyewitness News.